The number of procedures that a patient needs really depends on where they start from. If a patient comes in with small breasts, relatively symmetric, then they may need fewer than someone who comes in with very large breasts that needs a reduction as well. We're always trying to minimize the number of procedures performed. Obviously, patients would prefer it that way. However, every patient is different. So the average number is probably between three procedures, with the first one being the biggest procedure. This typically involves the mastectomy and significant recovery time. Secondary surgeries usually are day surgery. Patients come in, they leave that same day and go home. These are more secondary shapings. Nipple reconstruction can be done under straight local anesthesia with the patient awake, as can the tattoos. So it really depends on from where the patient starts and where they're going to end is how many procedures. Again, we're cognizant that patients can get tired after their breast reconstruction and they just want things done. They want them to look natural, they want them to feel natural, and our goal is to help them achieve that in as few operations as possible. There are several ways to reconstruct the pigmented skin around the nipple. The most common is using pigment such as a tattoo. And other techniques include taking skin graft from the inner thigh, but we found that most women don't want extra scars after undergoing breast reconstruction, and therefore most of them choose to have pigmented placed by tattooing. We can do that procedure here. We do that frequently for our patients. Some patients choose to go to professional tattoo artists as well. I like to tell my patients that their scars will tell their story. Every patient's going to be different. Again, every breast is different, and we can help those patients anticipate those scars once we evaluate them. Some patients, their scars are all tattooed over and they don't have visible scars. Other patients with larger breasts will require extra scars to bring the breasts into a smaller shape prior to reconstruction. Our goal is to reduce the number of scars that patients have, but more importantly, to educate them on what they might have. We find that patients, if they understand the process, if we draw it out for them, they're much more accepting and understanding of what their breasts will look like after surgery and after all the procedures are done. Many of the scars can be tattooed over, which is a benefit to the patient. Breast reconstruction surgery really can revitalize a patient, and therefore my best advice to patients looking for a surgeon to do their breast reconstruction is to find someone with a passion for that surgery, a passion for their craft.